You've heard the warnings about high blood sugar, but are you aware of the signs? With over 529 million people affected by diabetes worldwide as of 2023, it's crucial to recognize the alarming signs of this condition. Shockingly, more than 30% of individuals with diabetes are unaware of their diagnosis. But as someone at risk of living with diabetes, you need to know your body and watch for changes that could mean trouble. In this video, we'll reveal 7 alarming signs of high blood sugar. You'll be surprised by some of the signs we'll cover, so keep watching till the end. Number 1. Unexplained weight loss. One of the most alarming signs of high blood sugar is unexplained weight loss. If you're losing weight without any intentional changes to your diet or exercise routine, it could be a sign of high blood sugar levels and potentially diabetes. When your body struggles to efficiently utilize insulin for transporting glucose from your blood to cells, it resorts to breaking down fats and proteins for energy. This can lead to rapid weight loss, even if you're consuming the same or more calories. While weight loss may initially seem like a pleasant surprise, it's important to recognize that it's not a healthy outcome and should be addressed. If you've unintentionally lost more than 5% of your body weight within 6 to 12 months, it's advisable to consult with your doctor. They may recommend testing your blood sugar levels to determine if you have prediabetes or diabetes. The positive news is that with early detection and appropriate interventions, like adopting a balanced diet, engaging in regular exercise, and taking prescribed medication, the progression of the condition can often be slowed down or prevented. It's advisable to aim for a gradual and sustained weight loss of 1 to 2 pounds per week through these lifestyle modifications. Unexplained weight loss should not be taken lightly, as it is a serious matter. It's crucial to address it promptly by getting tested and taking appropriate action. Number 2. Excessive thirst. Another common sign of high blood sugar is excessive thirst, also known as polydipsia. When your blood sugar levels are too high, your body tries to get rid of the extra sugar by making you urinate more. This can make you feel thirsty all the time because your body is losing fluids. If you constantly drink fluids because of your thirst, it may make you urinate even more than before. This cycle can create disruption in your daily activities and sleep patterns, as you wake up frequently to drink and urinate. It's important to address excessive thirst because it can be a sign of poorly controlled blood sugar levels. If you're experiencing persistent thirst, it's essential to consult a healthcare professional. They can evaluate your symptoms and recommend measures to manage your blood sugar levels effectively. Number 3. Frequent urination. Frequent urination, also called polyuria, is another common sign linked to high blood sugar levels. When there's too much sugar in your bloodstream, your kidneys get busy and try to eliminate it by producing more urine. As a result, you end up urinating more frequently than usual. This happens because the kidneys regulate your body's fluid balance and remove waste from the blood. When there's an excess of sugar, the kidneys work harder to get rid of it, leading to increased urine output. Frequent urination can disrupt your daily routine and disturb your sleep patterns since you need to visit the bathroom more often. It's important to address this symptom as it may indicate uncontrolled blood sugar levels and potential health complications. Before we proceed to the next alarming sign, be sure to hit the subscribe button. Number 4. Blurred vision. If your vision appears blurry or unfocused, it may indicate high blood sugar levels. When there is an excess of glucose in your blood, it can cause fluid shifts in your eyes, leading to blurred vision. This is typically a temporary condition, but if you experience frequent or persistent blurry vision, it is important to seek medical attention. As your blood sugar rises, your body attempts to dilute the excessive glucose by drawing fluid from your tissues into your bloodstream. This can alter the shape of your eye lenses and the fluid levels in your eyes, resulting in impaired clarity of vision. You may notice difficulties in seeing distant objects clearly, reading small print, or focusing on specific items. These changes in vision usually occur rapidly but tend to improve once your blood sugar is controlled and the excess fluid is eliminated from your system. However, prolonged high blood sugar levels can lead to permanent damage to your eyes. Diabetic retinopathy, a condition caused by damage to the small blood vessels in the retina, is the primary cause of blindness. The longer you have diabetes and the less controlled your blood sugar is, the higher the risk of vision loss and blindness. If you frequently encounter blurred vision, spots or floaters in your visual field, or other alterations in your vision, it is crucial to promptly consult with your doctor for an eye examination and diabetes evaluation. Number 5. Numbness and tingling. If you experience numbness, tingling, or a pins and needles sensation in your arms or legs, it could be a sign of high blood sugar levels. This happens when there's too much sugar in your blood, causing damage to your nerves, known as diabetic neuropathy. Initially, you may feel these sensations in your fingers, toes, hands, or feet. If high blood sugar is the cause, you'll typically feel this numbness or tingling on both sides of your body in a similar pattern. For example, you may feel it in the same fingers or toes on each hand or foot, or in corresponding areas on both limbs. These sensations usually start slowly and worsen over time. If blood sugar levels are not controlled, the loss of sensation can become permanent. In severe cases, numbness and tingling may spread to your legs and arms. High blood sugar can also lead to nerve pain, sharp sensations, or sensitivity to touch. The best way to prevent and relieve these signs is by managing your diabetes effectively. Work closely with your doctor to develop a treatment plan that includes medication, a healthy diet, regular exercise, and monitoring your blood sugar levels. Controlling high blood sugar can help prevent further nerve damage and may even reverse some numbness or tingling to some extent. It's important to note that any loss of sensation that has already occurred may be permanent. Number 6. Fatigue. When you feel consistently tired and lacking energy, it can be challenging to perform daily tasks and enjoy your favorite activities. You might be experiencing fatigue, which is a common symptom associated with various factors, including high blood sugar levels. This symptom is often observed in people who experience frequent urination, which can lead to dehydration. Increased urination can cause your body to lose water, making you feel thirsty. The cycle of dehydration and thirst can worsen fatigue. As you urinate more frequently, your body's hydration levels decrease, making you even thirstier. This can lead to drinking more fluids, which in turn leads to more urination. This cycle can contribute to prolonged fatigue. It's important to note that fatigue can also be an early sign of high blood sugar levels, even in individuals without diabetes or prediabetes. Consuming a large amount of simple carbohydrates, such as sugar, can cause mild fatigue. If you consistently feel tired after eating carb-heavy meals, especially if it affects you in a specific and bothersome way, it may be worth consulting a medical professional. Number 7. Increased hunger. When your body has an excess of glucose, it struggles to use it for energy and sends signals of hunger to compensate. This can be due to unbalanced hunger and fullness hormones. Even after eating, you may still feel unsatisfied. To address this, there are a few steps you can take. Firstly, ensure you stay hydrated by drinking enough water. Additionally, opt for foods with a low glycemic index, such as those high in fiber, protein, or healthy fats, as these will help keep you feeling fuller for longer. Engaging in regular physical activity like walking, swimming, or yoga can also aid in glucose utilization and improve hormone regulation. Lastly, monitoring your blood sugar levels consistently and consulting with a healthcare professional can provide valuable guidance and assist you in making necessary adjustments. Thank you for watching, and make sure to watch more amazing videos from our channel.